Thank you very much, MC. My able deputy minister, directors of the ministry, and the press. This is a very straightforward matter, and I would want to go straight to the point. Ladies and gentlemen, it has come to our attention as a ministry that some union leaders, the emphasis is on some union leaders, have developed the penchant of attacking my person at the least provocation, and in most cases without provocation. I think that as a ministry, we have a clear mandate to deliver, to improve upon the health sector. And it's expected, especially the players in the sector, for everybody to come on board for us to improve upon the sector. We have Mahama cares to deliver. And at this point in time, we are ruling out the secretariat. We have free primary health care to deliver. And we are aggressively pursuing it. We have to ensure that claims at National Health Insurance are paid promptly. And all of you attest to the fact that we are doing so. We have our health facilities to retool. Maybe within the week I will be taking delivery of equipment for screening of cervical cancer delivered by telecell. These are the issues. When we took office, the portal for admission, we have to improve upon it. Today, as I speak to you now, people sit at the comfort of their homes and can apply. These are the things I think that everybody must come on board for us to address. How we can fight outbreaks. We have impulse at hand at the moment. We have the National Rapid Response Team, we have the Regional Rapid Response Team, the District Rapid Response Team, and very soon we are taking delivery of vaccines to integrate it as part of our response mechanisms. We have huge numbers of health professionals who have completed schools and they are still at home. And the government is putting effort in place to be able to make sure that these health workers who are at home get employed. The government is looking at employing some of them. We are looking at how we can export some of them. The measures include how we can look at it from the point of making them attractive on the global market. Specialists coming out with programs, that will make them specialists. And at the moment, as I speak to you now, we are looking at the post-basic specialist program. We've constituted a committee, including the rector of Ghana, Ghana Nurses and Midwives College, and then the registrar for NMC, right? For all of us to come together, let us come together and find solutions to the problems that exist. That is our preoccupation. Ladies and gentlemen, at this point, let me use this opportunity to state the chronological event that happened after the incident that occurred at Ridge Hospital. On Monday morning, I sent a delegation to Ridge Hospital to ascertain the situation. When the delegation came back upon debriefing, I realized that I had to follow up. Ladies and gentlemen, let me state this, that I have the health workers of this country at heart. And so any attempt by any individual or any group of people to try to incite the health professionals against government, pretending he cares more than us, is unfortunate. And we must stop that. It's an avoidable tension we must avoid. It doesn't help the sector. If indeed you are a practicing health professional in the sector, it doesn't help the sector. And so, when the delegation came back, I had to follow up. I was in company with the Deputy Director General and other directors of the ministry. We joined the medical superintendent at the Rich Hospital, and I visited the victims. After going around, we had a closed door meeting to discuss the issues, not insults. One, how to look at beefing on the internal security, staffing issues. So, after the closed door meeting, I came out to address the press to categorically condemn the physical aspect. And that is the most important aspect. And for me, let me at this point reiterate to the whole country that irrespective of the level of provocation at any health facility in this country, nobody, irrespective of your status in society, absolutely nobody has the right to attack any health professional in this country. That is the gravamen of the issue. No diversionary tactics about handshaking. That is what we must concentrate on. To send a clear signal that our health professionals working at the various health facilities are safe. And so, after the engagement with the management, when I pulled out of the wards, then, in fact, in the engagement with the management, I made it clear to them that I had listened to their side of the story. Therefore, as a minister, I will also listen to the other side of the story. And I then constituted a committee to look into the matter, bring out recommendations for implementation. A lawyer, a nurse, a medical doctor, an auditor, an HR person to go into the matter. Now, when I pulled out, my attention was drawn to a gentleman called Ralph, who was at the center of the controversy. And so he was working towards us as a group. The medical director was with me, the deputy director general was also with me. Then I asked, why did you do this, gentleman? When I asked, most of you were there. I mean, the press, you were there. So you can attest to what I'm saying. You were there with me. When I asked him, the gentleman then stretched his hand, shaking me, and trying to whisper something into my ears. Ladies and gentlemen, at this point, should I push the guy that don't whisper anything into my ears? Should I stop him? Should I shout at him? Even if that guy has been prosecuted and sentenced to life imprisonment, and he stretches his hand to shake me, as a minister, as a public officer, I have the duty to stretch and greet him. So let us not reduce the fact that I shook hands with him. Does not mean that I should stop any measure or any steps that the ministry or government will take to unravel the situation. And so I understand on a more lighter note, I have been reminded of the fact that I'm a farmer. Yes, nobody needs to remind me. I'm a proud farmer, and everybody knows it. Hold on to my appointment, I was one of the largest rice farmers in this country, and I'm proud of that. Please, we have a lot to deliver, and some of these things will not divert our attention. we'll continue to do our best for Motherland. I thank you for the opportunity.